Working for you. Good afternoon.
Hi, good afternoon.
Good afternoon.
Good discussion.
Thank you.
Victimization of women. My question was victimization of women. How long do a police take to come when someone complains that their relatives are lost, are not coming home? Okay, I said that because since yesterday a little girl from Newton gonna leave, that she gone to work until now she ain't come back yet. And the police them say must wait until certain hours, but she leave 4 children home here for the parents to maintain. Until now they ain't come to do nothing. And a lot of noising say that she has gone with a boy or something, but the children here suffering. So I want to know about the problem, why the police ain't can't go and search.
Okay, can I ask you, caller, what time did you report or whoever report this person missing?
Since last night, 7:30.
Okay, the reason I asked you that question is that if my memory is correct, somebody is not declared as missing unless 24 hours has passed.
But she leave children here.
I understand what you're saying.
But if in drugs, they don't come for drugs, I want to the drug more than in a human being.
Oh my goodness.
I didn't fully understand.
I didn't either. It seems as if it's a complexity of issues that might be at play here. But what I do know, unless somebody out there in the hierarchy of law enforcement could call in and educate us, my understanding is that somebody is not really declared missing unless 24 hours has passed. And if she's saying the person went missing after 7 last night and we are now about 10 minutes to 3 o'clock, then I don't think we have reached the 24-hour mark yet. That being said, I will not say or basically discount the concern that they have in terms of the individual leaving children who are vulnerable and unattended, because that is an issue. And if that continues, then some sort of intervention will have to take place in terms of the next of kin. And if the next of kin doesn't take step up to the plate and deal with that matter in terms of the care of the children, then the state steps in. But meanwhile, the search for the individual should continue.
Working for you. Good afternoon.
Good afternoon, Mr. Letroy Williams.
Good afternoon.
And good afternoon, Madam Boss, Miss Wendy Phipps.
Good afternoon,
Carl
sir.
Brown here.
Yes, I realize.
And good afternoon to the listeners home and abroad. Miss Phipps, the question on children being left alone. Children should not be left alone, you know. Because here is it. The children is structured by a large-based family, you know. There's a father, a mother, most of the times 2 grandmothers, 2 grandfathers that are alive. Right? Sometimes they have passed on. But here, they are also godfathers. Sometimes they are also stepfathers. They are aunties, uncles, nieces, nephews. So I cannot see why a mother or a father will go out to work, and you are telling us in the Federation that out of all of these family members, friends and neighbors, is nobody you can get to come and babysit or stay with your child while you go to do a few hours work. Something is wrong with us, boss. Totally wrong with us. And we need to go and correct that wrong. The other thing, Madam Phipps, is what are we going to do concerning these elderly persons that we have working in the health sector who are 70 plus years and over, jogging, walking with a walker, a cane, and all those things, and we still have them employed going to the services, which is unable and incapable of performing their role and their duties, while young people who can contribute something to the Federation, these people are getting the Social Security. Some of them already get the pension and get it. Some of them already don't get a gratuity. And we are hindering young, vibrant people who come out of college, universities, who come out of high school and want to do something positive and contribute considerable to the nation, while these elderly people who are supposed to be on retirement is holding them from receiving a meaningful job. And I have been asking this to my unity government over a year now, The other point is, Madam Boss, I would like to see and would wish when our ministers are going to come and sit, because listen, the civil service is in a very disarray. It is not satisfactory to the public who is paying us. We are not giving them their work for their buck that they are paying us. We are lapsing bad, terrible, and disorganized, Madam Phipps.
Okay, Carl.
We need to get that organized. Gone.
Okay, Carl. Thank you.
Okay. If we could...
Working for you, good afternoon.
Good afternoon, is this the cable?
If it's where?
The cable.
No, you have the wrong number.
I'm sorry.
Okay, let's try perhaps what we can do while we wait the other caller is to try to give some sort of clarity to...
There is a caller.
Okay.
So we're going to take one more caller after this because we have to start wrapping up.
Exactly.
Working for you, good afternoon.
Yeah, good afternoon again, Mrs. Phipps and Minister Phipps. You didn't comment on the last question where I think was the most important thing, where we need to have a health insurance plan.
Oh.
So I wanted you to comment on that based on the overall objective in terms of looking at everybody in the country, because I heard the senior minister in the ministry spoke about a new plan coming. So I wanted you to comment on that here.
Okay. Again, caller, just to remind you that this show was basically to focus on International Women's Day, and I do realize that when the opportunities arise, the public want to get their questions answered. What I will tell you is that the matter of the National Health Insurance does not fall immediately under my remit. As you noted earlier, that falls under the responsibility of the Honorable Eugene Hamilton. What I will tell you, however, is government's position on the issue, which would have been articulated in the Team Unity Manifesto, which is universal health insurance. The concept behind that is to provide insurance for persons who do not have insurance. And let us just make sure that we clarify to the public that civil servants are already covered with health insurance via national insurance. Quite a number of private sector firms are already providing insurance for their own workers. So who we are primarily concerned with are those individuals, whether they're employed or unemployed, who are not covered by any type of insurance. And it is a matter that Ministry of Minister Hamilton is looking at. It is national health insurance. I am no expert in insurance, but what I will tell you, it is not something that you can develop by the snap of a finger. It is something that has to have the benefit of the data governing it. It is going to take into consideration issues such as contribution or no contribution. For example, you know, Lesroy, that if you go out and you try to get insurance on your own for medical reasons, you have to pay for it. Yes. Right. Similarly, even when you have it, you might have thresholds beyond which they will not pay, which is sometimes referred to as the co-pay, which you pay a portion and they tell you what they pay. Similarly, when you when you insure your house, you have a limit in terms of a deductible in terms of what they're willing to pay for. So if you know you only lost 2 shingles in the hurricane, don't bother make a claim, because only unless you lost half of your roof, and this is the threshold, then they pay attention to you. And by the same token, I think we need to approach the matter of the insurance with an abundance of evidence, an abundance of data, and of course an abundance of caution, because what you also want to make sure is that national insurance is sustainable. And you also have to bear into consideration that St. Kitts and Nevis, and I've said it now for the 3rd time in this program, is populated by only 50,000 persons. I also said in this program that the total number of employed persons as of December, unofficial statistics from Social Security, is just over 25,000 persons. Okay? Which means that by a process of extrapolation, you have half of the population who technically are not employed, whether they're the elderly, whether they're children of school age or whether they're just who we might want to consider the unemployables. Those persons who don't work, they get looked after. They probably live off remittances that relatives send for them, or they earn a living that the formal economy doesn't know about. So they slip through the cracks and we don't know what's going on, or they're not interested in having a job whatsoever. So even in the process of determining how you provide insurance for that subset, we have to be sure that these people are individuals who are not defrauding the system at the same time, because it's a small market, it's a small tax base, and it has to be sustainable, and there must also be levels in it that says what we can afford and what we cannot afford. So it is not the type of process that you go into willy-nilly. Even if you look at the news, for example, the famous Obamacare program, that is still trying to work the kinks out. Then you have National Institutes of Health, even in the US, national insurance schemes in the UK, in Canada, and they can become monsters, because people need to understand that yes, while the government is trying to assist you with health care, at the same time you have a responsibility to police your health, because we would much rather have a healthier society than to have a society riddled with health challenges that cost us more infrastructure, more dollars being spent on trying to preserve life and extend life and hold on to life. And then you find that because you're diverting most of your reserves into that area, the other areas of development that people should be enjoying to have a better standard of living, you can't gear too much towards that. And that is a delicate balance that we walk when it comes to that. Our healthcare budget for 2016 is only 46.1 million. But that being said, we were able to successfully fight in estimates to make sure that we ended up with a top-up of over $7 million, which is something that is commendable, and that is the reason why we are able to extend the social outreach in terms of cases such as the one listed by the last caller, with the scenario he gave about he and his siblings being unable to help their mother get medical care once she has been diagnosed with cancer. Okay? So it is a work in progress, but as I indicated, what the government's proposal is, because we don't want anyone to be denied care. We want to make sure that everyone who needs care has the access to care that they require. But then somebody still has to pay the piper. Okay? Because even though healthcare is generally free in St. Kitts and Nevis, and we're very proud of our record with that, going back to the early days, even before independence coming forward, there is still a cost, and it must be financed from somewhere.
Minister, is there anything that you would like to say in closing?
Well, I just wanted to congratulate all women in St. Kitts and Nevis as we approach International Women's Day, to salute them for their efforts. A lot of our women, as you said earlier, are unsung heroes. They're the ones who make it happen, just like the theme for last year's International Women's Day. They're the ones who are more likely to go out and sacrifice for themselves, to go without shoes, go without basic necessities that they require, so that their children could go to school with something to eat and clothes on their back, that all their textbooks are bought. And they're the ones that make sure that they're in at night by a certain time, that homework gets done. Granted, there are men who do that too, but unfortunately the numbers are not as high as the women who are the primary caregivers. So we do advocate for women's rights. We do also advocate for women's responsibilities. The responsibility to look after yourself, the responsibility to educate yourself, and the responsibility to make sure that you have a free mind that doesn't limit you from attaining the potential that you set out to achieve.
But Minister Phipps, I thank you so much for joining us today on the program to discuss very, very important issues as it relates to women within the society, women's role, how women should be empowered, how women's rights and so on should really be protected and promoted within the society. Because at the end of the day, women's inclusion and women's empowerment can only redound to a better society.
That is so true.
And its contribution to both economic development, sustainable development, and human development.
That is so true,
So I thank you so much.
And I thank you for accommodating me, and I trust that the public has found some little morsels of information and advice, and also in terms of direction as to what is available to them through the Department of Social Services gender affairs and community development. And again, I wish every woman in this country, whether they are a mother or not a mother, or somebody who functions in the role of a mother, a very happy International Women's Day when it comes.
Right. Well, I want to thank you for listening to another edition of Working for You. We will be back next week. Of course, we'll have another informative discussion for you next week. I am your host, Lesroy Williams.
Working for You. A weekly talk radio program which highlights developments of national interest and the activities of your St. Kitts Nevis government. Join host Lesroy Williams as he presents news, views, reports, and interviews about everything regarding the activities of the Team Unity government and the building of our communities and the development of St. Kitts Nevis. Tune in and call in to interact with your government and share your views regarding the upward forward development of your community and our beautiful Twin Island Federation. Working for You is weekly, every Wednesday live from 1:30 p.m. to 3 p.m. on ZIZ Radio, Win FM, and Sugar City FM with rebroadcast on participating stations. Working for You.